This lecture follows Chapter 6 and your Chapter 6 PowerPoints, which you can see on this screen. So I'm going to go through them, I'll go through the PowerPoints as we talk. I'm going to focus primarily on the diagnosis part of this chapter. I will, of course, incorporate some more discussion about assessments, and then I'm also going to touch on ASAM criteria, but we're going to really focus on diagnosing right now. And so following through with your PowerPoints, you can see, your book and the beginning of these PowerPoints go into great detail talking about how many individuals struggle with addictive use disorders. You can see the numbers here highlight how many people struggle with both mental health and addictive use disorders. And what we're finding is that more and more folks who struggle with addictive use disorder have a comorbid mental health issue. Comorbid means that there's two mental health issues occurring simultaneously. So a substance use disorder and maybe depression, or two substance use disorders possibly, just multiple substance use disorders occurring at the same time. And so what this means is that as a counselor, it is imperative that you be able to address both addictive use disorders and mental health issues. And if you remember back to the chapter on professionalism and professional issues in addiction counseling, you remember that there is a sect of addiction counselors that do not work with and are not trained in mental health issues. So let that sort of sink in for a second. We know the prevalence rates of comorbidity when it comes to addictive use disorders, and so you can see how it's imperative that we talk about being able to work with both addictive use disorders and mental health issues at the same time. That being said, it's imperative that we do our work and due diligence in screening, assessing, and then, of course, diagnosing mental health issues. I'm going to jump down here to this screen here. So this goes into exactly what I was just talking about. First, we do a screen. So what we do is we screen for an addictive use disorder, and we determine whether a problem could potentially exist. Or you see may here is in italics. We want to first see, does an addictive use disorder exist? Or is there information the client is giving me that's leaning me in a direction to start asking if a substance use disorder exists? I have put the CAGE. You guys had experience using the audit, and I'm going to put, if I haven't already, put the CAGE, C-A-G-E, screening tool up, and I want you to look at that and just kind of look at what types of questions are asked when we want to screen for an addictive use disorder. Assessments are used to confirm or rule out. These can be formal or informal assessments, but really what that supports or invalidates our screen. Okay, so I thought maybe there was an addictive use disorder. I'm going to bring in this assessment, and that's going to support my hypothesis, or it's going to rule out my hypothesis. And then, of course, diagnosing, utilizing the DSM. That is assigning a diagnosis and a certain set of criteria to the mental health issue or the addictive use disorder that you see. All right, and when we talk about how do we sort of define a diagnosable substance use disorder? And your book puts it nicely. So a substance use disorder is characterized by a cluster of cognitive, behavioral, and physiological symptoms indicating that the individual continues using the substance or the behavior, like we talked about process, despite significant substance-related problems. So basically what this means is it's a group of symptoms that are cognitive, behavioral, and physiological that the individual uses and cannot stop using despite significant problems in various areas of their life. So with that being said, let's jump to substances. So these are the substances listed in the DSM: alcohol, caffeine, cannabis, hallucinogens, inhalants, opioids, sedative hypnotics or anxiolytics, stimulants, tobacco, polysubstance, and other. And of course, we know gambling is also in there, and but this is specifically just looking at substances. So what's interesting about diagnosing is that the criteria is the same for all substances. The criteria for diagnosing is the same for all substances. And you're going to see that in just a second. The difference is what substance we insert in diagnosing, and potentially some of the withdrawal, and maybe even some of the tolerance. So, sorry guys, flipping through my notes here. All right, so when we diagnose a substance use disorder, it doesn't necessarily have to have a physiological dependence. We talked about dependence and withdrawal a couple of weeks ago, and remember that physiological dependence and psychological dependence can both occur and doesn't necessarily have to exist. Physiological dependence doesn't necessarily have to exist. And so what we're looking for when we look at diagnostic criteria are 3 or more of the following. And put really short, is the individual using over a longer period of time? Has it turned from social use to needing to use all the time? Has there been a desire and or an attempt to cut down or quit? Has the individual indicated that they have thought that this was their use was somewhat problematic, that they either tried to quit or even cut down? Does the individual spend a significant amount of time acquiring the substance and using the substance? So is their day and their life and their focus starting to revolve around the substance? Is this causing problems in those various areas of their life? Work, school, family time, role obligations, et cetera, et cetera, et cetera. Has the amount of time being focused on the substance becomes so significant that now it's causing problems in these areas? Is there craving? Are they craving the use of that substance? Are they continuing to use despite negative consequences? And again, in those various areas of life, like social, occupational, recreational activities, is it affecting their social and interpersonal life? Are they causing problems in their social and interpersonal life? And despite all of this, are they continuing to use? Going down, do they continue to use despite hazardous situations? And this can be continuing to use despite placing themselves in pretty dangerous situations. So let's say going into pretty dangerous areas of town to acquire drugs, or now engaging in behaviors to get drugs that are quite problematic and dangerous. An example of this is maybe someone who is now maybe getting into prostitution because of their substances. Okay, we know that that's probably a hazardous situation. And are they continuing to use despite placing themselves in this hazardous situation? That can also mean continue to use despite hazardous situations to their physical self. So are they continuing to use despite having medical problems? One of the examples I used in your assignment is, does an individual have cirrhosis of the liver? And even with that pretty grave medical diagnosis, are they going to continue to use? Is there evidence of tolerance, and is there evidence of withdrawal? So this is the basis for diagnosing all substance use disorders. And like I said, the only difference would be inserting the substance that they are using. So using opiates over a longer period of time, using alcohol over a longer period of time, examples like that. If you go to the DSM, the very first 4 criteria speak to pathological patterns of drug abuse. 5 through 7 talk about social impairment. 8 through 9 talk about risky use, and 10 through 11 talk about pharmacological. That's tolerance and withdrawal. So there's a category to how these are diagnosed, and the criteria, what the criteria address, and you can see here that it's in these 4 categories. Substance use disorder can be diagnosed from mild to severe depending upon the number of criteria endorsed. So if there's 2 to 3 symptoms, I'm going to jump back over here. If there's 2 to 3 of these symptoms And remember, this is just kind of an example of the 11 criteria. If there's 2 to 3 of them, they're at mild. If there's 4 to 5, they're at moderate use. And if there's 6 or more, they're at severe. So let's see. So this jumps into the different instruments. And I don't want to go too much into this because you guys can read a lot. You can read on your own about this. Let's see. Here's the cage. I thought I uploaded it, but it is in your PowerPoints. And really, this is again going back to screening, asking these questions just to determine whether or not you think maybe someone could potentially have a problem with substance use disorder. Have you ever felt the need to cut down? Have you been annoyed by someone's criticism? Have you ever felt guilty after drinking or while drinking? And do you need a morning drink or an eye opener? This is really important. These 4 questions alone are not enough to diagnose somebody with an addictive use disorder. This is a screening instrument. If you were to ask these questions to somebody, this would only give you enough information to consider administering an assessment, which is going to validate or invalidate your thought, which is going to move you into the diagnosis. And then, of course, you're going to look at those specific 11 criteria and see if they meet them. Then you only need 2. Remember, 2 to 3 is mild. You only need 2 of the 11 criteria to diagnose with an addictive use disorder. So your PowerPoint lists a bunch of assessment measurements that can go through and screen or assess whether or not someone has an addictive use disorder. Some of these assessments are normed for specific categories. For example, let's see, it's down here somewhere. So these are assessing misuse during pregnancy. There are some that are specific for adolescents. There are some that are specific just for adults. There are assessments that are specific for specific drugs. So, for example, there may be an assessment that is used specifically to determine alcohol, if there's a problem associated with alcohol, and there are some that are used to determine if there's a specific problem with another drug. The problem with these assessments, some of these assessments, is that they can be long. I just happened to stop on this personality assessment inventory, and as you can see, there's 344 items. I challenge you to get someone who is withdrawing and or still using to sit through an assessment that has 344 items. Now, you guys had experience using the audit, which is much shorter in duration, but obviously does not give you as much information. So whatever agency setting you may be working in, they're going to have their preference for an assessment, and it's going to be up to you to use their assessment. Using these assessments takes some practice and some skill and some finessing, because some of the questions speak to trauma, and they speak to things like sexual assault or rape or just in general trauma history. And we have to be mindful about how these are asked. But, you know, go through and really read up on these different assessments. Again, just to sort of reiterate, you know, I want to jump back. Sorry if I'm making you guys dizzy. I want to jump back to the criteria. The criteria for diagnosing a substance use disorder is the same for all substances. It's the same. We're still looking at the same criteria. The difference is what substance are you looking at? And of course, the behaviors that the individual exhibits are going to be different depending upon the substance they are using. And then of course you have to, you know, we have to look at tolerance, we have to look at withdrawal, we have to look at the level of severity in our efforts to diagnose. You're going to get a lot more, if you haven't already taken diagnosis, you're going to get a lot more experience diagnosing in diagnosis. But, you know, this is just a quick, short, brief little lecture on diagnosing addictive use disorders.